Hello to everybody. My name's Wolfgang Rottbauer. I'm head of the Department of Cardiology at Ulm University in Germany. I'm happy to present to you today the procedural steps of a transseptal mitral valve replacement using the HighLife valve system. The HighLife procedure is outlined here, is basically done in 3 steps. In step 1, on the left side, the loop placement catheter is advanced retrograde over the aortic valve, and a wire loop is placed around the mitral subvalvular apparatus. In step 2, a ring made of biocompatible polymer is put over the wire and locked. And in the final step 3, using a transseptal approach, the HighLife valve is deployed in the ring and the annulus of the mitral valve. The patient selection, the procedural steps are carefully pre-planned by a CT scan in which different views, similar to echo views, are defined that allow for implantation guidance. As outlined here in these 4 pictures, the 1-chamber, 2-chamber, and 3-chamber views are mainly used for guidance of wire looping, and the 1-chamber view for ring placement. And the 4-chamber view is usually used for valve deployment. As just pointed out, in the first step, the loop placement, the 1, the 2, and the 3-chamber views are used for stepwise wire guidance. So the first part of the looping is done in 1-chamber, the second in 2-chamber, and the third in 3-chamber. The looping guide wire is then captured, as you see on the movie on the left, in the ascending aorta with a snare. Its position around the mitral valve chordae is verified then, as seen on the right movie, in 2D and 3D echo, and the wire is cinched around the subvalvular apparatus. You see that the ring is kind of closing around the mitral valve chordae. When the position of the wire is then perfectly confirmed, the captured end of the guide wire is externalized out of the patient. The ring delivery catheter is then advanced over both ends of the looping guide wire into the left ventricle. The polymer ring is deployed, then locked by tension applied to the externalized looping guide wire ends. The third step is the mitral valve prothesis implantation. This is now done by a transseptal approach. The valve deployment catheter is advanced over a Lunderquist pre-shaped wire across the mitral annulus, the already implanted ring, into the left ventricular cavity. In the first part of valve deployment, the ventricular portion, shown on the left side movie, is deployed. And then, this is pointed out on the right side movie, the ventricular portion of the valve is brought back to the already implanted valve ring, and both then structures are brought back to the native mitral annulus, and then finally the atrial portion of the valve is deployed. Here you see the final results on these slides. On the left side, angiogram, an LV angiogram through a pigtail catheter coming through the aorta, and on the right side, TEE that focuses on the implanted HighLife valve with a nearly perfect result and no paravalvular regurgitation. So let me summarize for you. The HighLife system is a very robust, straightforward technology with well-defined procedural steps. It uses established components in percutaneous valve replacement that have proved their efficiency and safety already in other situations like TAVR. Good pre-procedural planning and intra-procedural imaging facilitate high procedural success even in the early adoption of HighLife technology. With this, I would like to end and wish you a very successful EuroPCR 2021.